there was a gap of 2 weeks. I hope you missed as much as I missed you all interacting with you. And the question answer session, whenever you ask some questions, it feels very nice because it also revises my mater medica and the rubric form. So today, let me discuss first of all a case before the question starts. Let me discuss a case first, then we'll go to the question answers. Yeah, Navjot, good afternoon. सबसे पहले एक केस डिस्कस करते हैं, an interesting case, and this case, had been coming to me for a long time, but there was actually only minimum result, and this case basically was a case of the patient was suffering from chronic acidity, so much acidity that he had to take a lot of antacids and all for the past about 10 to 15 years, but there was no result. And I had given the patient was angry personality, and he used to get very angry easily, was not able to perform his duty properly, was expecting a lot of things in life, could not do anything in life, and a lot of other symptoms, and we had given a lot of medicines, but with no relief. And when I asked him what was the cause of anger, the patient used to think, what is the cause, मेरा क्या cause होता, क्यों मेरे को इतना गुस्सा आता है. And surprisingly, I had given medicines, 2 or 3 failed. Then I prescribed the patient the medicines carcinosin. I gave carcinosin 1 ml single dose and called him after 15 days. And the patient came to me after 15 days and he said, sir, for the first time in 15 years, I have only taken 2 antacids. And gradually in the course of 4 to 5 months, his all acidity went off and he became normal. The very interesting thing in this case was that whenever you are not able to identify, of course, as a doctor, you can say that he's angry because he is not able to do anything, he's angry because he is not able to do this, he's angry because XYZ problem. This is our interpretation. But sometimes, the patient is not able to identify the cause of his anger or her anger. And he feels, I don't know why I'm angry. And the mother and father comes and tells you, or the associate who are accompanied with him tells, I don't know why he's angry. Everything is good in life. So when the anger is causeless, means the patient is not able to identify, even after you suggesting him, then you must take this rubric anger causeless. And then adding few symptoms, I gave the patient carcinosin 1 ml, that cured the case. Sometimes it is very difficult, to take this rubric anger causeless, because as a doctor, remember my words, remember my wordings, I always tell to my assistant doctors. As a doctor, we can always see, because of this dominance there is anger, because of not doing a work there is anger. We are able to pinpoint the anger. Maybe that is not the cause. वो cause शायद हो नहीं सकता. But then we only identify the symptoms, we only identify the rubrics, we only create rubrics, and then prescribe the medicine, and then there is no cure. So this case has taught me, if you take the rubric anger causeless, the patient is not able to pinpoint the cause of anger. He says, I don't know, it may be, it may not be. We give a lot of suggestions, but he is not able to pinpoint the anger. Then take this rubric anger causeless, my dear friend. I hope you understand. Disha, Nitin, Navjot. Hi, hello, Dr. Babal. Yeah. In this rubric, when I was going to the medicines, I found 2 medicines very, very useful. First was carcinosin and second is chilidonium. A chilidonium patient always feels that he has done some unpardonable sin. And that's why there's a problem in his life. That is chilidonium, my dear friends. So anger causeless carcinosin cured that case. So if you have this type of patients in your practice, try to first identify whether you are taking the rubric is applicable to the case. Don't create rubrics or take out rubrics which the patient has already told you. Okay. So let us go forward with the question. Sir, any medicine for dog ticks? Yeah, there are a lot of medicine for dog ticks. So first you must think about sulfur. I have few dogs, the patient comes with their dog. I normally tell them don't come with the dog, because there are patients who are not happy with dogs coming in the clinic. So sulfur is there, mesarinum is there. I had treated a case fantastically with graphitis, and one case was with anthraxinum. In fact, if you have seen my case, I had cured a case of cancer of the palate of a dog before treatment. After I have the photographs also. I don't know whether I have told you that case, but fantastic. Okay, sir, tell me something a recent scenario of COVID. First of all, if the COVID comes, I feel the symptoms which the patients are getting about COVID are not so severe. इतना ज़्यादा severe नहीं as what we got previously, but okay, if mutation occurs, then we don't know. But in COVID, before also and now also, I tell, it is basically more of fear than of disease. We have treated, we have cured so many cases of COVID infections. I have told you in my webinar also. Just be patient, just take the case one by one as it comes. Don't try to club symptoms and give the remedy arsenic and kalicaram and phosphorus, and because everybody is giving. Every case, try to identify one symptom or two symptoms which are very uncommon for that case, which are very uncommon for that personality, and then you will be able to prescribe properly. Okay, Hemant, hello, yeah. Nitin says, sir, medicine for vocal tics. See, there are no specific medicines which I can tell you. अगर आप मुझे symptom कुछ, if you tell me some symptoms, then I'll be able to tell you the remedies. So this was the first case which I told. It took anger causeless. I hope you have not taken this rubric up till now, and try to take the rubric if at all the symptom similarity matches. Now there was a case, and the patient had come to me. Again, see, in homeopathy, after 30 years of practice, it is important to understand how will you enter the case, what do you think about the case, and the experience. The patient comes to you in the clinic, and the patient says that on the face you can see the patient appears very red because of anger. The face, the expression, redness of face in anger. Don't ask him how is the anger, how does he behave in anger. You can see that the face is red in anger, my dear friends. Do think about belladonna, do think about naxomica, do think about chamomilla. Just one thing in belladonna which I would like to add, that belladonna patient agar gussa hota hai, if the belladonna patient is anger, the anger is only for a certain time. You can say for a certain moment, then he bounces back. That is belladonna. This is a very, very important symptom. And if the patient is angry, you can see the anger on the tip of the nose. The nose becomes red. I have seen a lot of cases in my practice. Previously I used to think that maybe it is because of a lot of cold. Maybe my AC is very chilled, my chamber is very chilled. That's why the patient is getting redness of nose. But no, redness of nose in anger. You must think about vinca minor. Vinca minor, a fantastic remedy. Sometimes, you have to go with your instincts, with your experience. In vinca minor, there is one symptom which you have read very, very commonly. Hair falls out, it is replaced with gray hairs. And we used to give, a lot of vinca minor to personalities, but nothing used to, hair color never changed. So think vinca minor when there is redness of tip of the nose in anger. Are you with me? Are you with me? So these are very, very important indications of remedy where you can see that remedy in the patient's face. So don't ask and complicate your case. That is very important. Sometimes believe in your experience. Okay? Medicines for vocal tic, I told you, Nitin, I can't tell you because I have never given specific for vocal tics. I always prescribe on symptomatology. So if you can give me some symptoms because of that, I'll be able to answer. I am not a specific remedy prescriber. So if you ask me remedies for certain things which I have never used in my practice, so I'll not be able to answer that. Though mathematica wise there are a lot of remedies, but I have never prescribed on specifics on vocal tics, so I cannot tell you. In fact, if you have seen my case, if you have seen my video, I don't know whether it is put or not. I had prescribed a case of vocal cord paralysis. I had prescribed a case of vocal cord paralysis with cantharis. Can you imagine cantheris in vocal cord paralysis? I have cured that case. I have just taken a video on the cantheris, on which symptoms I prescribed and how did I interpret those symptoms in rubric form, and cantheris cured the case. So I'll ask my assistant to put the case on YouTube. Do watch the symptom of cantheris. Okay. Yeah, involuntary sounds producing because of tics is a normal symptoms. I am telling you patient's personality. I am telling you the individualizing symptoms of the patient. That is important. Don't prescribe on common symptoms of the remedy. Okay. About 200 webinars, 200 YouTube live I have taken. So this much I think you must understand. I am basically prescribing on the patient's personality. I'll tell you one more case. There was a case, I don't know whether it has been put on the YouTube, but there was a fantastic case where I prescribed Rumex to the patient. Absolutely different symptoms of Rumex you have never heard in your practice, because interpretation of the patient's language into rubric form and Rumex cured the case. These are remedies which we have been using for complaints of cough and cough. But if you understand the remedies in a different aspect, you will see that the remedies, the common remedies only, will give you some symptoms which we have never thought of. In fact, I remember a case of Rumex where the patient used to come and tell me, during the attack of asthma, during the attack of breathlessness, during the attack of difficult respiration, the patient would go into so much despair. The patient used to come and tell me, Doctor Sahab, it is better to die, it is better to commit suicide rather than suffering from such asthma. Now this was the only symptom which I took for prescription, and there's a beautiful symptom in Rumex: suicidal disposition, despair from spells of asthma. Are you with me? Are you with me? So, suicidal disposition from spells of asthma, if you see, the only remedy is Rumex. This is the beauty of interpreting symptoms or understanding symptoms in the patient's language. That's why I keep telling, if you want to see the practice, if you want to see the doctor, you have to go in his chamber and see how does he prescribe. That is what I have always told in my international lectures and seminars. Dr. Bawal will also appreciate that. It is very important to see how the doctor is practicing, in which symptom is prescribing, Otherwise, this symptom, suicidal disposition in asthma, I also was very much surprised that it is present in Rumex. Okay? अस्थमा ठीक हो सकता है क्या सर? बिल्कुल हो सकता है जी, बिल्कुल हो सकता है. Producing involuntary sound from mouth due to anxiety, very embarrassing situation, kindly tell some medicine. I think you are fixed on anxiety. You can have a lot of symptoms related to anxiety, from producing sound to palpitation to XYZ. I have always told you before, Nitin, go and find out what is the cause, what is causing so much anxiety. That's why he has involuntary sounds, So unless you go into the detail of case taking, how can you prescribe on the symptom anxiety? If you go to the rubric, there are hundreds of medicines. So you cannot prescribe on those, just by once you prescribe on this symptom, that will go, something else will come. The body will always take out symptom unless you reach out the perfect cause of the disease. Okay, let us go further. Please suggest medicines for aspiration, pneumonia, and orphan squirrel baby after forcible milk feeding. Okay, though, my dear friend, I have not prescribed for a squirrel and this type, but I would have prescribed for a lot of human beings, for aspiration and then symptomatology. So in this case, there are 2 or 3 medicines which have given me very, very, very good results. In fact, I have cases where I go to the ICU where there is aspiration pneumonia and the child is on ventilator, and I was called to give medicines. I have few child who have been recovered with these medicines. Two medicines have given me fantastic results in my practice. The first is Ipecac and the second is Antimtart. Of course, there are some other medicines also, but these two medicines have given me very good results, Ipecac and Antimtart. And let me be very transparent with you. When I visited a child, he was on ventilator, and there was I could not get symptoms. I was confused what to give, either Ipecac or Antimtart. I give the patient to apply Antimtart on the chest and then Ipecac on the chest 2 hourly alternating, my dear friends. And the child beautifully recovered within 24 hours. The ventilator was off, and gradually in a course of 6 to 7 days, he was shifted in the room and then out of the hospital in 10 days. So this is what I want to tell you. Even sometimes I am not able to differentiate between remedies, so I prescribe Ipecac and Antimtart to that child alternately, applying on the chest. He was much better. Okay, that's why I keep telling, go in the doctor's chamber and see how he's prescribing. That's why you can learn on hand. Otherwise, on a lecture or a seminar, we present the best cases. But in the OPD, it is very important to understand, yes, we also fail. Sometimes we are also in a problem what to prescribe. We are human beings. In homeopathy, everybody is a student, that if you have that confidence that, okay, if we can fail after 30 years, the students feels confidence, yes, we can also fail. So there is a clarity, and that's how you build confidence in the practice. Okay, sir, feeling dizziness from last 10 days, drowsiness, bit uncomfortable, drying due to it. See, first of all, dizziness, drowsiness, all are functional symptoms, and it depends on why are you feeling that, my dear friend. If you tell me some reason that why you are feeling that, maybe I'll tell you better. Squirrel baby making kit voice and suffocates. I think who is there, I don't know the name of the person. If this is the problem, then you should think about Ipecac. Please prescribe Ipecac. I don't know how will you give it to a squirrel, but normally, if a child is not able to take, what I do, I take a syringe, I put some Ipecac 30 to 3 drops and normal saline, and give that injection in the mouth of the child. This is how I give. So if you can also give this, you can give. See, if dizziness is there and there is no symptoms, so I will give suggest 2 or 3 medicines. First is of course Aconite, first remedy. Aconite is wonderful. Second, dizziness, you can think about phosphorus. Third, while driving especially, think about Ipecac. And fourth, you can also think about Naxonica. Tripathi, BP my 160/95. Yeah, you can take Doxa. Puneet, you can take Rauwolfia serpentina. You can start this in the dose 10 to 15 drops in half cup of water thrice a day. But that would only control your BP. Blood pressure, you just identify in your case what is that increases your pressure, mental pressure, or what is that which has increased your mental pressure for 4 to 5 years. Go to that remedy, go to that situation, understand it, then prescribe, and I think you'll be able to give the medicines. Okay. Nitin, see, vocal cord, I have already told you I cannot prescribe on local symptoms. I need the symptoms of the patient. So it is a difficult thing for me to prescribe. Hello, Dr. Anuj Pawar. Welcome. Sad hair. Okay. So let us go forward. So I was just telling something about, anger, and face in which the patient comes to you, redness of face. Sometimes, what happens? The patient is angry. There was one question which was asked on the WhatsApp that बहुत जल्दी गुस्सा आ जाता है. The patient gets angry very easily. Now we have remedies for that also. There was a beautiful case. There was a beautiful case of a doctor who had come to my clinic. There was a lot of anger in the wife, and there was so much anger, so much clashes in the family. Okay, I'll just first, I am taking gelsemium for dizziness. Yeah, see, in gelsemium, dizziness and drowsiness is there, but there's a cause for that with heaviness of the eyes and all. But especially in driving, that's why I told you the remedy. So I was telling you. So there was so much anger, there was so much fights in the family that they were thinking about divorce. In the Sora, I asked that lady was absolutely calm, quiet, very well. But because of some cause for the husband's side, she has become so bad. Now they started fighting, ending in divorce. I prescribed the medicine. Next month the patient came to me and they said, sir, thank you. Now we are not going to divorce. I am feeling much better. The anger has been subsided. This is the beauty of homeopathy medicines. Will you please suggest? I told you, doctor, you can think about aconite, think about Nux, think about Ipecac, think about these remedies, because it is by driving. So you have to take motion part. You can take coculus also in this case. In gelsemium, it is basically static or anything. So motion sickness, if you are telling, then it is different. Okay. So let us go forward. Yeah, let us go forward. So I was telling something about anger. So anger easily, anger easily. Now we have rubrics we have remedies for that. But then I always tell, if you have anger, बहुत जल्दी गुस्सा आ जाता है. Yes, we have definitely medicines, like of course anger medicine will be most of the same, like we have chamomilla, we have Nux, we have lycopodium, phosphorus, platina, thuja. But then my dear friend, for example, there is a Hindi wording, मेरी मुर्गी की एक टांग, means the patient cannot bear contradiction. थोड़ा भी उसको नहीं बोला, थोड़ा भी उसके दिमाग से बात चली गई, नहीं हुआ तो उसको गुस्सा आता है. सो एंगर फ्रॉम लीस्ट कॉन्ट्रडिक्शन, छोटा भी चीज से गुस्सा आना शुरू हो जाता है. एंड द वेरी इंटरेस्टिंग रेमेडी इज निकोलम कार्बोनिकम. So this is how we have to interpret the symptoms. Why is the cause of anger? Otherwise you always prescribe the routine medicine for anger and you will not be able to prescribe these remedies. For example, there was a beautiful case in my practice and the patient used to come and tell her, sir, I get very angry. What if my two children suffer for something and they become angry and they fight together? What will happen? So I become very angry. I always tell them, be good. What if if I'm not earning properly and my wife starts telling me that you are not earning properly? I'll get very annoyed, and then my anger will, and the my wife and I'll start fighting. What if it happens? That's why I'm very angry. I get angry very easily. So what is this symptom and what is the remedy you can think about? So you can think about the anger, what I'm telling you. I'll go back to the question first. Is high BP possible because of high cholesterol and low vitamin D? See, these days, vitamin D is basically used and misused too much. Most of us have vitamin D deficiency. So if you open the books in the internet, you will find vitamin D causes high blood pressure. But keeping aside that, high cholesterol could definitely cause high blood pressure. So that is also one of the cause of high blood pressure. But in homeopathy, make sure सब पुनीत के mental cause ढूंढना जरूरी है. If you get the mental cause, automatically you will get the remedy. भाई मेरी 10 की जॉब है, क्या करो? I did not understand the question, doctor. Will SBL sub ulcer work? Yeah, it will work. So it's basically Rolfia serpentina is basically medicines for high blood pressure, physiological doses. So till you take, or for some time, the BP would be normal, then but again it will start rise. It will again rise. So you have to find that homeopathy potency which can treat your complaint, doctor. 10 की जॉब है, पैसे नहीं आते. I still not understand the question. Do I need to take it always? Yeah, I'll tell you, if you take it for some time, the BP will come to normal. But if you take for always, after a certain time, the medicine will stop working. That is definite. So when the medicine stops working, then you will have to think of something else. You can think about Cratagus or Arjuna. But this will keep happening in your practice, in your case. So till the time you are not able to find out the simillimum, you can take that to just treat that BP. I am 14, I am facing hair loss, hair thinning at age. How can I stop it? Yeah. So see, at the age of 14, if you are suffering from thinning of hairs or this type of problems, in homeopathy we call that a constitutional medicine is important. If you take your whole case and find out the cause, why you have thinning of hairs, why you have hair falling, then you will be able to understand and prescribe. For hair falling at young age, I have seen some medicine which work very well. First is phosphoric acid, second is jaborandi, third is arnica, fourth is vinca minor. But my suggestion to you would be a case taking detail is important to prescribe. How many times a day feel drowsiness? I am not getting the question. Drowsiness, see, if you open the, this basically, drowsiness basically is a very generalized symptom. How many see, if your remedy is right, it would work in hours. It is like that. So you have to have the right remedy. Yeah, at a very young age, doctor साहब मैं बता रहा हूँ, वही बता रहा हूँ कि at a young age you have to still find the cause. Why? Gelsemium. If the gelsemium is right, it will work in hours. If you feel that you need to do repetition, make sure that you take gelsemium L potency. Okay, but still, if you have taken gelsemium, it is not working, then it is not advisable to continue that. You have to take some symptoms and then prescribe. Okay, think about aconite, think about cocculus, think about Naxomica. These are also remedies. Just match the symptoms. Okay, so let us go forward. Interesting. So I was telling something about what you call, anger. Anger. What was the remedy which you think of prescribing to that person? That person who came to me and he had anger. He was thinking that way. So what medicine you would prescribe? Anybody? Anger easily. He was thinking that maybe his children would fight, and that anger, maybe if he does not earn properly, her wife will scold her and they will start fighting. So which remedy comes to your mind? How can I become white? I am brown. No, I have never had a case in my practice where I had a case, the patient was brown and I gave medicine and he became white. I don't have an experience of treating those type of cases. I have not in my practice. So I was telling something about which remedy comes to your mind. Anybody? Navjot, Dr. Babal, Disha, a lot of there online. What case I was telling about and which remedy comes to your mind? That is very important. Wife feeling palpitation when feeling anxiety. Yeah, this is a very generalized rubric. Palpitation and anxiety. Of course, we don't have a rubric for a wife especially, but palpitation because of anxiety, lot of remedies are there. Palpitation because of anger, lot of remedies are there. For anxiety, you can think of platinum also, China, spigelia, pulsatile acid, phosphorus, lot of remedies. Yeah, you can try. So let us go forward. Yeah, angered easily because of some imaginary thoughts, and that remedy which I prescribed was mephitis. Please repeat. Yeah, so you can think about remedies for anxiety. There is palpitation. Think about pulsatilla, phosphorus, phosphoric acid, aconite, crataegus. Sorry, okay. Pulsatilla, natrum mure, phosphorus, phosphoric acid, crataegus, calcarea carb. This is what that comes to my mind. Okay, have you got it? Natrum mure, pulsatilla, phosphorus, phosphoric acid, crataegus, calcarea carb, sulfur. There are a lot of remedies you can think about, and always if you try to get the remedy, then put the repeated chart, then put the filter of hot, thirsty, thirstless, one more symptom, and then you can do that. So let us go forward. Iberis also, yeah, you can use that. Yes. Iberis also. Ignitia Amra also you can think about. But these are the basic. There are a lot of hundreds of medicines for anxiety and palpitation. Okay, I have told you what I have prescribed in my practice, 30 years of practice. Okay, so let us go forward. Interesting questions. Interesting. I hope you understand that, sir. Please block chess. Okay. Yeah, we are actually the end of the. We are actually at the end of the session. After a long time, I have been. I took 2 Saturdays to get to the session. So I hope you enjoyed it as much as I enjoy sharing my knowledge with you. So until next Saturday, meet you. Goodbye.